How is lisinopril-induced cough diagnosed? Have you ever wondered how doctors figure out if a cough is caused by the medication lisinopril? This medication is often used to treat high blood pressure, but it can sometimes lead to an annoying side effect, a persistent cough. Let's break down how this diagnosis is made. First, the symptoms play a key role. The cough linked to lisinopril is usually dry and does not produce mucus. It can start shortly after beginning the medication and may become bothersome enough to affect daily life. Next, timing is important. If the cough begins after starting lisinopril and improves when the medication is stopped, that's a strong indicator that lisinopril could be the culprit. This connection helps doctors narrow down the cause of the cough. However, coughs can arise from many different issues. To ensure accurate diagnosis, doctors will look for other possible reasons for the cough. This may include checking for respiratory infections, asthma, or chronic bronchitis. A physical examination, medical history, and sometimes tests like chest X-rays or pulmonary function tests may be necessary to rule out these other conditions. In some cases, a doctor may want to confirm the diagnosis with a rechallenge test. This involves reintroducing lisinopril under medical supervision to see if the cough returns. If it does, this further supports the diagnosis of lisinopril-induced cough. If the cough is bothersome, doctors might consider switching to another medication. Not all medications in the same class cause coughs, so finding an alternative can help manage blood pressure without the side effect. Managing high blood pressure is important, but so is ensuring comfort during treatment. While some people may tolerate a mild cough, persistent or severe coughs should be evaluated. In summary, diagnosing lisinopril-induced cough involves observing the timing of symptoms, ruling out other causes, and possibly conducting a rechallenge test. This thorough approach helps ensure that treatment for high blood pressure continues effectively while minimizing discomfort from side effects.